and welcome to Speak Your Mind on Gold FM, only the classic hits. This is a live radio show, but the delayed coverage shown on FBC TV. I'm Louise. Thank you for your company. And, we do have, following cyclones, the risk of exposure to potentially fatal diseases such as typhoid, dengue fever. We've also got the Zika virus and who knows what else. But in the studio today, Dr. Mike Kama, he's kindly going to give us an update of what the Ministry of Health is discovering and also doing around the country since Cyclone Winston struck on February the 20th, to be exact. Welcome once again, Dr. Kama. Good to have you back on the show.
Thank you, Louise, for inviting me to the show. And I'd like to also say good afternoon to all the listeners.
Vinaka. Well, before we start on everything in health terms, I always like to start off on a bit of a personal note with my guests, like where are you from? What part of Fiji?
Thank you, Louise. I'm actually from just Suva area, but
Okay.
I've spent most of also my life, especially my younger years, in Rakiraki.
Raki.
Yes.
Okay. Well, anyway, so Dr. Kama, is it right that typhoid has similar symptoms to malaria and can be fatal?
Yes, absolutely, Louise. Typhoid is basically a disease of humans, and primarily it's an endemic disease here in Fiji. So in its own right, it can be fatal if it is not properly managed. So each year, for the last 6 years, Fiji basically registers about 250 to 300 cases of typhoid. So basically it's a sporadic, meaning it occurs in places and it's never clustered, those 250 or 300 cases. And we have an average of 2 deaths in a year that is associated with the disease. So it's quite a bad disease to actually have.
Yes.
And it's associated basically with hygiene at most times. So if one keeps, washing their hands and practicing good personal hygiene, also environmental hygiene, it should keep the disease at bay.
So, I mean, that's just simple steps, but it's amazing how some people don't do that. Like personal hygiene, washing your hands before you eat. And, must be a lot of host of other things. That's how you get typhoid. But, Dr. Kama, how many typhoid cases have been reported so far around the country since Cyclone Winston struck?
Okay. From January this year until now, there's been 85 cases reported from around the country, and about 45 or so of those since the tropical cyclone Winston, the aftermath of the tropical cyclone. Yeah.
So that's just added on another 40 from since January.
Yes, absolutely.
Oh, thank you. So which areas has typhoid been reported from?
As I'd mentioned, typhoid is endemic. So we have hotspots around the country, and they've been reporting 1 or 2 cases. But the focus this time has been in the Tailevu area, in Korvo, in the subdivision, in some of the villages there. So that is where the focus is at the moment. It's confined to that focus. We've had 21 cases so far in 2 different localities. So the Ministry of Health is working tirelessly together with other ministries and also the communities in trying to bring this under control.
Okay, so any deaths yet because of typhoid fever since Cyclone Winston?
Yes, there hasn't been any related cases of deaths to typhoid.
Oh, that's a relief. Now, what is typhoid fever caused by?
Yes, typhoid fever is caused by a bacteria that's called Salmonella typhi. The reservoir for this bacteria is usually humans, so it's in the gut and also in the bloodstream of human. And basically how one gets it is transmission from another infected person. And basically the conduit is either water or food contaminated by the infected person and then transmitted to the uninfected person. Within, say, 4 to 14 days, they get the disease. They start to show symptoms. So that's the incubation period, about 14 days. And within that incubation period, they're able to transmit, although they don't show symptoms. So this is the the issue with this disease. So they can actively transmit. But the thing with this disease is once they get antibiotic treatment, they should be able to recover within 2 days, and within 7 to 10 days, complete recovery. So they get better within 2 days and complete recovery within 7 to 10 days. So the symptoms are very clear with this disease. So you get abdominal pains or stomach pains. sometimes diarrhea, sometimes constipation. You have to have fever.
Okay.
And at times there's also some rash, but that's not very frequent. So, but if you have an abdominal pain and you have some diarrhea and you feel very feverish, it's important for you to seek medical attention.
Okay, so once they do seek medical attention, how do you do the test? You look under a microscope or something?
Well, there's a symptom that the doctors will identify that would be suggestive of typhoid, and if it is such, they will treat immediately. But at the same time, they will take some samples from you. They will take probably a blood sample, send it off for culture and sensitivity. It's a microbiological test to identify the bug. Or they'll also ask for stool, so because the bug is cleared through the intestine, through the defecation. So that's the two areas that they can identify the bug.
So, like, it's quite easy to spread, right? Because of, how you said through feces and all that, and especially after cyclone when they don't have proper toilets and all that.
Yeah, so the ministry sees this as a high risk period when the engineering system perhaps in villages and communities are really down post disaster. So these are issues that tend to rise, especially from hotspot localities. So yes.
So it's a lot of work for you to make sure you contain it. So since Cyclone Winston, about 40 plus,
Yes.
and do you expect any more cases?
Well, with our health workers on the ground are actually working overtime to try and control this the current issue we have, and also in working on environmental and personal hygiene and sanitation in order to control the emergence again of this disease.
Okay, so how can a person avoid getting typhoid again?
It's a basic hygiene. You have to adapt to basic hygiene.
So like washing your hands before you eat?
The primary one is to wash your hands. So wash your hands after the toilet, wash your hands before you eat.
Yes. Just develop a habit of it. Make it a
to be
way of life, and I'm sure Ministry of Health would get a lot of help with not getting it to spread.
Yes, the philosophy about, the general philosophy is that these bugs, when they see that, they will invade. When you allow them the opportunity to invade, they will invade the human body. So for us, the response is just to be clean. They don't like cleanliness. They will always like that.
Okay. Well, thanks very much, Dr. Kama. We'll be back on Speak Your Mind. This is Gold FM, only the classic hits, your only classic hits radio station in Fiji. Welcome back to Speak Your Mind on Gold FM, only the classic hits. And we have the pleasure of the company of the National Advisor of Communicable Diseases. Now, Dr. Kama, thank you so much for your time as we cover the topic of typhoid. Now, Dr. Kama, do you think our people are well educated about hygiene and sanitation?
Thank you, Louise. That is an assessment that needs to be made. So a knowledge-based assessment. But we've been sending out these health promotion messages and so forth for many years now, and people are probably, we assume, that people are well acquainted with typhoid, what it is, and so forth. At this point, yes.
Okay, then. So with the poor environmental sanitation now after the cyclone, what have you been advising people? How have you been getting them to not have dirty places to live in?
We have a risk communication team that is basically doing that, preparing the messages that need to go out, and setting up sessions such as this to communicate with the public. And we also have our health workers on the ground who are doing interpersonal communication with our communities, especially the ones that have been affected in the cyclone, heavily affected. So that has been ongoing.
Okay, well, have they been receiving the message loud and clear?
That's what we would expect at this point.
So they, like the village headman, he can make sure that all his villagers follow it and just be clean, not to get typhoid.
Yes, absolutely.
Okay, then. So What is your message to the public to avoid getting communicable diseases common after natural disasters or otherwise?
Yeah, so the fundamental advice from the ministry is basically a basic hygiene to adopt and practice basic hygiene and also good environmental sanitation practices. That is the fundamental. Washing hands,
Right.
boiling water,
Okay.
having a good nutrition and good diet. So this is important to raise your immunity level.
I
You have
see.
to have this.
Okay.
You have to have fruits and so forth. The one that the ministry basically advises on.
Mm-hmm.
Environmental sanitation. Keep your compounds clean so that you can reduce the possibility of insects, especially mosquitoes and so forth, invading your household and yeah.
Okay, so there's a host of things that you need to do to make sure that typhoid is kept away. But what do you think needs to be prioritized by the Ministry of Health in ensuring communicable diseases? I almost said none. Communicable diseases don't get out of hand since Cyclone Winston.
Basically, again, it's basic hygiene and environmental sanitation. So these are the primary things. So whether there's a cyclone or post-disaster or whether there isn't one, this continues to be the primary thing. You won't go wrong if you continue to practice this every day.
Okay.
And I think it is also important not only for for adults but also for us to be mentoring our young. Our children and so forth to be practicing this on a daily basis. So again, boiling of water, hand washing, and so forth.
Yeah, that's very true. You need to teach your children, and that'll carry on obviously through their life. That's what I'm always telling my son. Come on, wash your hands after you use the toilet. Wash your hands before you eat, because I mean, you touch everything. Especially kids, they're running around, touch dirty stuff and all, and then they just come and start eating. That's just not on.
Yep.
I mean,
Absolutely.
I know there's a lot of deaths because people just don't do that, wash their hands around the world. So, yeah, very important. Don't forget, always get your children to wash your hands before they eat, after they eat, and what Dr. Kama has also advised us. Okay, what about dengue fever? Are there any new cases reported so far, Dr. Kama?
Yes, so in the beginning of this year, there was a little bit of a surge in dengue fever that went up to over 100 cases. So that has come down drastically, even after the post-disaster and even 6 weeks after that, from the post-disaster period.
Right.
So that has really gone down. But there are cases, sporadic cases. Again, dengue is endemic in Fiji. There's always cases that pop up. Again, we register about 300 to 400 cases in a year. But these are sporadic cases, so they occur in different places, in different localities around the country. We're worried when, again, there's a cluster of cases, and then we tend to really zoom in to see what's happening in this area and whether there's an outbreak or not. That hasn't really happened with dengue at this point in time. It's still sporadic.
Okay.
Yes.
Okay. And so dengue is pretty okay now, but who knows, looking into the future. And the Zika virus. I mean, the last time we spoke about the Zika virus. And at that time, there were no reported cases at all. What about now? Have you had any reported cases? Confirmed cases, I mean.
Yeah, so again, with dengue, we never are supposed to be complacent about dengue and how we should prevent ourselves from dengue in terms of source reduction or cleanup campaigns or cleaning around the house in our environment, and also preventing us from getting bitten by mosquitoes. These are important. And again, with Zika virus, like dengue virus, they have the same vector. It's still the mosquito.
Yes.
And it's the Aedes mosquito,
right.
that basically the species that transmits this disease. So it's the Aedes aegypti or Aedes albopictus.
Yes.
The Aedes aegypti is basically urbanized, so you see it in the urban areas, and it's domesticated. You'll see it inside the house.
Okay.
Or around the house.
Right.
The albopictus is outside, so you'll see it in the gardens and so forth.
Oh.
So both diseases are efficient carriers of both the dengue virus and the Zika virus.
Right.
So in terms of prevention, the prevention activity is the same because it's just one vector.
Okay.
Yes. So basically with Zika virus, your question on Zika virus, we had 2 cases last year, and these were imported cases.
Right.
So they're well and they've returned to their country.
Mm-hmm.
And this year, I think the minister has already announced that we had one case, I think, in the beginning of the year in February.
Right.
And then I think 3 weeks after that, we had registered another 2 locally transmitted cases.
Mm.
Yeah, so the ministry is quite concerned about this and has already triggered its action plan.
Okay.
And that is something that we have to further discuss today with other collaborating partners, especially WHO, to see how it can be rolled out. Otherwise, because the the intervention are the same with dengue fever in terms of the vector.
Right.
So dengue fever interventions have been happening, as I had mentioned. There was a rise in case at the beginning of the year. So dengue intervention activities has been happening from January. So this is the reduction, trying to reduce the mosquito density.
Right.
So it works also for Zika, and that's probably why
Exactly.
it hasn't really taken off that much with regards to Zika at this point. But I think the ministry will have another statement to the media sometimes before the end of the week with regards to an update on the Zika situation.
Wonderful. Thank you, Dr. Kama. We'll be back soon for more on Gold FM, only the classic hits. This is Speak Your Mind. Speak Your Mind on Gold FM, only the classic hits. And Louise, we're with you. Thank you a lot for your company. We've got Dr. Kama, who's the National Advisor on Communicable Diseases in Fiji. And we were just talking about the Zika virus and how, well, I'd put it this way. It would be expected to come into Fiji because of the fact that it's that same mosquito that gives us dengue fever. So I read in the paper, it was on Saturday, that the minister had confirmed quite a few cases. So, I mean, this is a time to take action, I'm sure. So it is, destroying mosquito breeding grounds?
Yes, absolutely, Louise. So that is the fundamental prevention activities, destroying mosquito grounds.
Okay, so we need to do that if we don't want Zika to go out of hand. Because can you explain again what happens when someone gets the Zika virus?
Okay, thank you, Louise. So Zika virus is transmitted by the mosquito vector, and we've just discussed which vectors those were.
Yes.
So, it's transmitted by, an infected mosquito. So it picks up the virus through a blood meal from an infected person, and then
Right.
it goes on to transmit the disease to an uninfected person during another blood meal. So it injects the virus into the other uninfected person before it draws blood.
Right.
And then it goes on from there. So the density of mosquito is quite important for it to be able to transmit this to a very large population. So if we have quite a big number of mosquitoes that are infected in a locality, then the people within it will probably get the disease. So that's how transmission happens.
Okay, so we've been lucky with the other one, though, chikungunya. We haven't had any cases of chikungunya, have we?
Yes, we've had about over 14 cases of chikungunya in the past, spread over a certain duration, perhaps a 1 year period.
Oh.
So it hasn't really been as dynamic as, say, dengue and the other diseases. At this point in time, there are certain hypotheses why that is. And basically, it's got something to do with other arboviruses such as Ross River circulating in Fiji and so forth. So it basically lessens its appearance every now and then. So perhaps we have some safety or protection mechanisms already in place for diseases such as chikungunya, but they belong to a different family of virus. They're called the alpha viruses. But this one here, the Zika virus, they belong to another family of viruses. They're called flavivirus, and this includes dengue and yellow fever and so forth. So they're the characteristics a little bit different.
I see.
Yeah, so and the protective mechanisms on the occurrences in a particular population differ also. There's a lot of science that's involved in there at this point.
Okay, so how is the health ministry conducting continuous monitoring, as I've read in local media, because of the issue of typhoid, dengue fever, and I didn't mention leptospirosis?
Yeah, so From after the disaster, post-disaster period, the ministry, together with its partners, especially the World Health Organization, the WHO office in Suva, established a system called the eWarn system, so it's an early warning system of reporting. So they've got these diseases on that line. So we've got 33 sites all around government health facilities all around the country, and they report daily on these conditions. So these are clinically diagnosed conditions of leptospirosis, dengue, and so forth. So they report this, and then we analyze it and so forth, and collate the data and interpret it every week and report it up to the ministry.
Oh, okay. So it must be a lot of work. So the Ministry of Health, I believe, is working with international organizations. Who are they again?
So again, they're mostly WHO, but we also have working with UNICEF and SPC and so forth.
Okay, so what is the main focus of the Ministry of Health since Cyclone Winston?
The Ministry of Health, the main focus?
Yes, the main focus because of the cyclone, how we are expecting diseases to arise. So what has the Ministry of Health been focusing on as they travel around the affected areas?
Yeah, so it's basically the health facilities, getting it ready up and going in order for it to meet the demands that the population requires, or their population requires, whichever health facility. So that's one. I think the other one is in monitoring, surveilling communicable disease, something that usually pops up, the second week and also the fourth or sixth week during the recovery phase and also the rehabilitation phase. So communicable disease is one, but there are also different subclusters that the ministry has, within the ministry. So you have a health and nutrition cluster, the governance structure for how it basically responds at this recovery phase, recovery and rehabilitation phase, basically includes a health and nutrition cluster and a WASH cluster that looks after water and sanitation and so forth. Health and nutrition cluster basically looks after the other areas, including food and nutrition, mother and child health, also communicable disease, also the psychological aspect of it, and so forth. So they're responding right down to the operational level in each health facility. And these are the ones that are taking out these services to the people, and they're also waiting there for the people to come for this service.
Okay, so any new communicable disease popped up since Cyclone Winston?
The only one that we've been surveilling all this while is the Zika virus.
Okay.
So yeah, it's come onto our radar now, and we have to deal with that.
Okay, so you will obviously continue with the surveillance that you mentioned the last time we had the show.
Yes, so that surveillance is called syndromic surveillance. So different syndromes, different symptoms that pop up may suggest a certain disease.
Right.
So this is basically an early warning system. We can also identify new diseases through this system.
Oh.
So not necessarily just the one that we have going and circulating locally, but also new ones that might appear.
Okay, so you're keeping an eye out for maybe new communicable diseases.
Yes, there's always that possibility because, the generalization is that our immunity level, Fiji-wide is a little bit low at this point in time. It'll pick up.
Okay, so what about stress-related conditions? I believe when people have stress, sometimes it affects their health, their body, not only their mind, but maybe they can have some other kind of illness. Is that right?
Yes, it has a physiological impact. So it might reduce your immunity level at some point. So these are things that are in literature. It's also been proven.
So that's why it's really important to build your immune system. And the way to build your immune system is by eating a balanced diet, nutritious diet. But have you been to the places affected badly by Cyclone Winston? Have you actually personally gone to see any of these islands? Or maybe in Tailevu?
I've just arrived back in the country 2 weeks ago, so I haven't really moved around. But reports have come in. And there's a really good reports. They're quite detailed for us to be able to visualize what's happening on the ground. Okay,
well, we'll come back and you might be able to share with us the reports that you've been getting. Next on Speak Your Mind, Gold FM, only the classic hits. Speak Your Mind on Gold FM, only the classic hits. Thank you a lot for your company. Now, this is a live radio show, so you're most welcome to call. If you have any questions for Dr. Kama, our direct line 3220-907. And if you have a Digicel phone, it's 77-32907. And, well, Dr. Kama, maybe we'll talk, I think we've covered a lot on communicable diseases, haven't we?
Absolutely.
Okay, so just maybe differentiate communicable diseases and non-communicable diseases. Differentiate the two, because sometimes people get confused. They think, non-communicable diseases is like, how you get a virus if you have communicable diseases. So what is the difference between communicable and non-communicable?
Yeah, so largely, Louise, communicable disease deals with a germ. So it's either a virus or bacteria or parasite and so forth. And so this germ will basically invade the human body and cause a pathology, meaning, something goes wrong in your physiological system. And then there's the impact of being sick. So non-communicable disease is largely more behavioral. Although there is some element of behavioral aspects in communicable disease, but it is the bug that makes the difference, the germ.
Oh, so the bug. Which one would you say is more serious?
Which one is more serious?
So that they both have the same impact.
Well, I guess it depends on, people's perspective. Generally, human beings want to be well.
Yes.
And they weigh, both conditions in different ways. But no one wants to die earlier, and both conditions, if they are quite serious, can arrest life at an early stage. So I think it's your own balance. If you want to live longer, then it's to look at the advice that comes with this and practice good, better ways to live.
Yes, I mean, the Ministry of Health, I must say, is doing a great job in awareness. A lot of people changing their minds on just trying to keep healthy and live longer. Okay, so what about conjunctivitis? I mean, that was the headlines for a while. I'd say about a fortnight ago. I mean, every second person I saw in the street seemed to have it, and even at nighttime you'd see them wearing their sunglasses. So what is the situation with conjunctivitis now? Has it dropped, the cases?
Conjunctivitis, it is quite a contagious condition. So this one was a little bit explosive. Within 2 days, I think 4 weeks ago, within 2 days, the Central Division registered about over 700 cases. And in the last 14 or 15 days, the same division, especially in Suva, the capital, registered about 5,000 cases.
Wow.
So it just shot up. And even in the Eastern Division, there was about 100 cases within a week. And I'm sure there are cases out in the Western Division, also in the Northern Division, that we haven't really registered centrally at the ministry.
Yeah.
But, once it starts at one point, it will spread quite easily for such conditions. We're thinking that it may be an adenovirus, another virus that is causing this, and it has this kind of characteristic. So that is the status at the moment. I think it may have in the next update, we will probably have soon enough, perhaps before the end of the week, it would have gone above 5,000 cases. So internally within the ministry, we've put up an action strategy on this, in terms of surveillance, in terms of the clinical management of it, and also the prevention and control. So primarily, the symptoms once identified, there's always, again, basic hygiene that comes into the picture here. Washing hands, reducing contact of hands with the eyes. Because basically these viruses can survive for quite a while outside of the human body. Usually all viruses outside of the human body will die. Yes, but this one will survive. If an infected person touches the eye and then touches a table or something, it will remain there.
So if I come along and touch the table?
Touch it and touch your eye, and then it's transmitted, yes. So this is the issue, that we need people to continuously wash their hands and also wash the places that they may have touched. It doesn't transmit to other people.
Right. Use something like Pinoclean or Dettol.
Absolutely, those kind of things.
Yeah. So with conjunctivitis, best known here as Zika,
yes.
What I was wanting to ask, can it lead to a more serious condition of the eyes?
Yes, so this is what the ministry also juggles with at this point in time, with the post-disaster. What are its priorities in terms of outbreaks and so forth? So with regards to conjunctivitis, it has a high risk of being contagious, of spreading. But it won't kill you.
Okay.
And in terms of the complications that would lead to blindness and so forth, very little.
Okay.
Yeah, so you'll get the disease. It has an incubation period of 2 to 7 days, and then it might last 14 days to 1 month, but then it goes away.
Okay.
Yeah, so
it
the
can
virus
last for a whole month.
For a whole month.
Really?
But it will go away.
But that's bad. That's a really long time
Yes,
to have
it
an eye
is.
disease for.
Yes, absolutely. So at that time, you can have some very mild complications, keratitis and so forth, that might affect vision.
Yes.
There might be some blurry of vision and so forth. But at the end of it all, at most time, it will disappear. But the condition needs time. It has to run its course because it is a virus.
So viruses normally work that way. They run their course.
They run their course. There's no treatment, definitive treatment for it. The use of antibiotic eye drops, it will just protect you from superimposed bacterial infection, but it's not going to treat the virus. So you have to continuously wash your hands.
Right.
It's not a definitive treatment.
Okay.
This is prevent superimposed bacterial infection.
Okay, so continually wash your hands, and you know what I did? I got it for just 1 day.
Okay.
Last week.
Oh, lucky you.
We had quite a lot of people who did have it, but I just kept washing my eyes out.
Yeah.
Yeah, just running water.
Yes.
And I don't know, you're the doctor, but I might be a nurse, maybe. But salt and water, I just mixed it up a bit. I found that was really good for my eyes. Yep. And I just, scoop it in my hands and roll my eyes around in it, and there it was gone, just after a day.
Yeah.
Yeah.
So this basically helps. So that is the other advice. Wash your eyes well. But also use clean water. That is an important bit. Have to use clean water to wash.
Okay.
Yeah.
So this year, is this the most ever recorded conjunctivitis cases, like in a short period of time, or has it ever been like this before?
For
like
this
so many
year,
people?
definitely. Yes. But in the past, we've had one outbreak in 2011 and also another outbreak in 2006. So it seems to have a 5-year cycle. So these are reports from our ophthalmology unit, our clinics.
I see. So anyway, we'll be back and this is Speak Your Mind on Gold FM, only the classic hits. Welcome back to Speak Your Mind on Gold FM, only the classic hits. Dr. Kama here with us. He's the National Advisor on Communicable Diseases, those nasty viruses that invade our human body. But I'd just like you maybe to give a wrap-up since Cyclone Winston. It has been expected that diseases will arise. And maybe just an explanation from you to the people of what to expect around this time and what they should do to avoid getting communicable diseases.
Thank you, Louise. So the ministry basically at this point in time continues to monitor communicable disease, and the ones that we've discussed are the ones that they've focused on. So there's dengue, leptospirosis, typhoid. There's also the Zika virus issue, chikungunya. And those are the primary ones. And basically, we would also expect that our communities would be very sensitive to these conditions. And prevention is the primary and the fundamental response, or the fundamental responsibility for every individual and also all communities. So you have to be aware that basic hygiene and environmental sanitation is the primary prevention means at this point in time.
Okay.
So whatever the ministry will be providing or publishing with or in media statements, delivering to the public. These are the advice in terms of sanitation and hygiene that the community has to take on.
Right.
And basically,
Okay, so like you mentioned boiling water. So what about for like us in Suva? We didn't really feel that much, but is it still advisable that we boil our water, for instance?
Okay, so boiling water is basically targeted in areas where there's no treatment of water done. So
Oh,
in
okay.
areas where treated water is, there's no need to basically boil water, but it's also advisable, as a means of sanitation, to also boil together with treatment.
Okay, so even then it's been treated by the water authority, but
That is sufficient enough.
that's
yes.
sufficient enough. Okay, so we're talking about water contamination, like in places, islands where they don't have the proper water, they have boreholes and stuff like that.
Yes, even in the mainland. So we have
Oh.
places that are not accessed by the water authority and piped water, treated water.
Okay, so that is probably where most of your cases pop up of typhoid and the other sicknesses that we're talking about.
Diarrheal
But
disease,
especially typhoid.
Yes.
So typhoid too runs its course, as you were saying that viruses run a course, like a certain amount of time.
Yes.
If you get typhoid?
So basically, viruses do that, but bacteria, which is typhoid. Typhoid is a bacteria. So you can resolve or you can manage it with antibiotics. So it will go away, like I'd mentioned with typhoid. Once you start treatment with antibiotics, within 2 days they get better. Within 7 days, it's gone.
Well, that's pretty good. So what kinds of antibiotics do you give them? The normal ones that we get in the hospital?
Well, they have, I think they still have a store of antibiotics, stock of antibiotics in all hospitals. And for typhoid, mainly ciprofloxacin is the one that they are using at the moment. There's also chloramphenicol, so they have a range of drugs that they can use.
I see. So is it a painful disease like dengue fever? I mean, dengue fever, when you got it, you think you're going to die to it, so painful. What about typhoid? Do you feel the same thing, like really, really?
Yes,
full
you
of
feel
pain?
very sick. You
Very
feel very
sick.
sick with typhoid. You have very bad abdominal cramps.
Oh,
So for some, I think 1 to 2% of the population, they get the complications, and it's like intestinal perforation, septicemia. So people basically die when they have those complications. So we wouldn't want anyone to see anyone progressing to that stage.
okay. So how does someone get into that stage, like of seriousness?
Well, basically, they don't get treated. So the earlier that people get to hospital, once they see the symptom and think or guess what it is, and they present to hospital, then it's easy for the health workers to treat it.
Okay, so very interesting about all these viruses. So you're the man of communicable diseases. Is there anything else that you'd like to share with us, Dr. Kama, before we finish off on Speak Your Mind?
Again, it's just about basic hygiene and environmental sanitation. So I think the focus should continue to remain there, so that we can prevent this disease from circulating.
Yes, so I mean, it's pretty simple. Just to remember to wash your hands after you use the toilet, before you eat. And I know this is a message that you're driving through to the community, and they would avoid getting sicknesses like typhoid. So have you had any leptospirosis cases yet since after Cyclone Winston?
Yes, we've had leptospirosis cases. There have been some in the Northern Division. I think we registered about 11 cases straight after the post-cyclone period, disaster period. And we have also sporadic cases. Again, leptospirosis is endemic in Fiji, and it's transmitted. The reservoirs are usually animals, notably rodents, and also pigs, cows, and so forth. So usually straight after cyclones like this, when there's flooding, etc., it gets transmitted through the urine and so forth, and it reaches, and people pick it up.
So they can pick it up like
the cuts and abrasions and so forth.
Okay, so they're not wearing their shoes.
They're not wearing their shoes, and that's the general advice for them to put on footwear.
Okay.
Yes. So this is the issue with leptospirosis. Leptospirosis is one of the more deadly conditions compared to typhoid and dengue.
Really?
Yeah. So it basically kills more people, maybe 10 to 12 people in a year, compared to typhoid, which does so with 2 or 3.
Okay.
2 or 3 deaths in a year. So leptospirosis we register about at the ministry, we register about 10 to 12 deaths a year with leptospirosis.
Seriously?
Yes.
And yeah, I just can't get over the fact where people just can't take precautions by, well, I don't know. I mean, they catch these sicknesses, like you said, when water, like what, for instance, we're having floods now,
Yes.
right? So we're having floods right now as we speak in the Western Division, the poor people, our thoughts and prayers with them. But what kinds of viruses are expected to pop up after floods even?
So with regards to bacteria, not viruses, but
Oh,
bacteria.
excuse me, I
yes.
keep saying viruses.
So
Okay, what's the
leptospirosis
difference
is
between
one.
a virus and a bacteria then?
What's the difference?
Yeah.
Well, the different bugs, the different
I
germs.
see. I'm sorry about
entirely,
that. Okay,
in terms of
okay.
their characteristics and so forth.
Oh, right.
Yes.
Okay. Okay. So after the flood, what?
So
Communicable
leptospirosis is one of the communicable diseases that we tend to look out for.
The floods.
Yes, because of that interface between animal and human basically bridged.
Right.
So the closer we get to animals, that's the assumption.
Right.
Yeah, the better that leptospirosis circulates.
Okay.
So this is the condition that we look out for, and basically, rats will come in to use the stores that you have in terms of food. And they'll basically move to higher grounds, and higher grounds is where people are.
I see.
So the transmission mode there is just from the urine getting into water that men will
Stand
will
on.
stand on or step on.
Nakavakalevu, Dr. Kama. Thank you so much for coming.
Great.
Yep. And
you.
that's it for Speak Your Mind on today's episode. You can watch the delayed coverage on FBC TV. That's tonight, and we've also got one tomorrow morning at 10:30. And we'll be back again next week, Tuesday, on Gold FM, only the classic hits. Thanks so much for being with us.